Guys, welcome to my new channel. I'm going to be giving you all the latest about my journey into being a nurse, but this video is about how to pass the NCLEX. So if you're watching this, you're thinking this test is going to be hard, and it is very, very hard, but you can do it. You can do it. All you need is some good guidance and focus, and I'm gonna give you some tips about what helped me pass. So, step one, I think the most important thing is to set a schedule for yourself. And I really struggled with this. All of the YouTube videos and everything I read did not tell me anything about how do you make a schedule, like, and stick to it. I'm gonna tell you how I did it. So I graduated December 15th. I started studying January. My test was the beginning of February, so I studied for a month, maybe like a month and a week. So schedule wise, I think it's important to make a schedule that fits you and your lifestyle and the way that you learn best, because everybody is different. And I think maybe that's why a lot of YouTubers haven't discussed how to make a schedule for studying. So what I did, I studied, I would say about 6 to 8 hours a day for at least 3 weeks out of the month and a half or so that I was studying. You have to be on it. You know, I was particularly lucky because I did accept a job offer, but it was contingent on me passing my boards. So I just had that time to spend studying and not also working. First thing you need to do is set a study schedule. Add in some things, some self-care, read a book, watch a TV show. You know, you don't have to just study because your brain is gonna explode. But you still have to be on the ball, okay? If you want to pass. So, with that being said, everybody has different study styles. In nursing school and my first degree, I got my bachelor's in psychology as well. My style was always to just read the PowerPoints. Sometimes I will read the books, but only if it was like a really hard class. But I usually just get by reading the PowerPoints. However, NCLEX is not like that. You cannot just read PowerPoints, you know, go through your old school notes. Like, that is really not going to help you. What is going to help you is getting an online program. First of all, I completely 100% stand by UWorld. I think that is the reason I passed. There's different things. There's Kaplan, there's UWorld, there's Hearst. You can take a break, but not too many breaks, okay? I would recommend studying every day. I would. And even if it's just, sometimes I would just do like 5 questions if it was a long day and I didn't really have time to do 8 hours of studying. You know, you just have to keep your brain working and stay focused, because this is one of the most important tests that you're ever going to take. I mean, if not the most important test. I mean, I plan on getting my doctorate in nurse practitioner, so I'm gonna have to take another test. But that's neither here nor there. Anyways, so the second step is to review content using a review book. I use the Kaplan Basics book, and I also use the Saunders Comprehensive Review book. So I read those from front to back. And reading these books, it helps bring all of the knowledge that you learned in nursing school together, and it shows you the important concepts that you're actually going to be tested on for NCLEX and the stuff that you need to stick with you throughout your career. So when I first started studying using these books, I started by using note cards, and I would write a note card for all of the terms and concepts that I was having difficulty with or that I just wasn't that familiar with. But I started to notice that my note cards were piling up, like up to here, and I was like, there's no way I'm going to be able to get through studying all of these note cards, so there's really no point in me continuing writing them. I switched from using note cards to writing in a notebook. In my notebook, I would write more general concepts, things that I know maybe on the test, and stuff that I had struggled with throughout nursing school, stuff that did not come easy to me. For example, in most nursing programs, you take NCLEX-like tests throughout the whole program. My school, we took Kaplan exams. Some schools take HESI exams. So the concepts that show up on those exams are similar to the concepts that are going to show up on the NCLEX. And I know personally for me that whenever I would see anything about Cushing's disease or Addison's disease or like any hormone related disorder, I had no clue what was going on. So when I was reading my content books and I got to endocrine, I was writing away. Like, I was writing until I understood what Addison's disease was and what the difference is between it and Cushing's. So that's one way I use my notebook. Another way is the pharmacology. So the medications are definitely important, but you do not need to know every single medication. I separated it in my notebook by drug class. So each page would have a different drug class, and I would make a list of all the drugs in that class, but I would focus on the indications and the side effects for that specific drug class and not the specific medication. Because there is some discrepancies between medications in the same drug class, but you don't really need to know all of that. You just need to understand the bigger picture. So do not try to memorize every single medication and what it does and what its side effects are, because it's either not possible or you have a photographic memory, and go you. So the content review books help you because when you get to take the practice test, which is step 3, you're going to use an online program to take practice tests. What you're seeing on the practice test isn't completely foreign. They're bringing up concepts that you have just read about. So it makes it easier to understand. It makes it easier to take the practice tests, and you're going to do better on them because of it. So step 1 is to make a schedule and stick to it. Step 2 is to review content using review books. Step 3 is to use an online program to take practice tests. So some tips that I want to give you guys that will help you during the exam. I'm going to skim over some of the ones that I think you should already know, which is to read the whole question, read all of the answer choices. After you choose an answer, go back and read the question to make sure you're answering the correct question, and also to pay attention to keywords. For example, if a question says, what do you do initially? Don't answer with what you do finally. Answer with what the first step you would do. And also, if a question asks anything about the nursing process, like how do you assess this patient, you want to answer with an assessment, not with an evaluation, not with an intervention, not with a plan of care. You need an assessment. Answer the question that is being asked. Now, my more important tips that I want to focus on. Tip number 1 is to always think about patient safety. That should always be at the back of your mind, because safety is the most important thing in the real world and in NCLEX. And with safety comes prioritization and delegation. With prioritizing, you need to know what patient to see first, who's at most risk. You need to have a lot of exposure to these type of questions, because I definitely got multiple questions about prioritizing on my NCLEX exam. I also had a question where I had to put trach care, the procedural steps in order using a Dropbox. So everything is not going to be multiple choice. For delegation, you need to know this because as an RN, you will be responsible for delegating to LPNs, nursing assistants, and other personnel. So a question about delegation will definitely show up on your exam. So UWorld has over 2,000 practice questions for you to create your own tests with, and I really like that. So it gives you the option of picking certain topics that you're really struggling with. So after you take a couple general practice tests, you'll see a breakdown of the different categories like maternity, mental health, critical care, things like that. And it'll tell you what's your score on these specific categories, and you can see if you're not doing so well in certain categories. Like for me, maternity, I was below 50% in, and the other categories I was at least at 50% or above it. So I knew that that was something that I really needed to focus on. And I wasn't really surprised because OB was not the best subject for me in nursing school. So it's best to start off on UWorld by doing randomized tests. So you'll do a 75 question test. That's the maximum that they allow you to do. It puts together a random test with all of the different categories, and that's more realistic as to what the NCLEX is going to be like, because it's not like you're going to take the NCLEX and there's going to be all of these psych questions or all of these maternity questions. It's completely random. Some people get no OB questions and some people get a bunch of OB questions. So it's best to be prepared and focus on all of the topics and make sure you pay attention to the ones that you are struggling in. So like I said, maternity, I was not doing so well in. So as I was taking the general tests, I also did a complete 75 question test with just maternity questions. That helped me out because you may not get time to get through all the practice tests on UWorld. So whenever you see a subject that you're struggling in and you take a test with all questions related to that subject, you're just exposing yourself more to that content because you may not get through all of those questions. So as you're taking the tests on UWorld, after you submit each answer, each question you get right or wrong, read the rationales, read all of the information they give you. Another reason why it's really important to read these rationales, whether you get the question right or wrong, is because the averages on these tests, on the practice tests and in NCLEX, they're pretty low compared to what you think they would be. So the average may be like a 55%. And you use different skills when answering these questions, and a lot of times it comes down to the process of elimination, aka making an educated guess about what the answer is. So you may get the answer right and you may think, okay, I don't need to read the rationale because I got it right. But no, you still need to read it because you need to know why you got it right. So as long as you read the rationales, you'll have a better understanding of the concepts that are going to pop up on this test. So I did an accelerated program. In 12 months, I got my bachelor's in nursing. But a lot of people do the traditional route, which is the 4-year bachelor's in nursing. So think about all of that information that you've learned over those 4 years and how scattered it is. Studying for NCLEX is going to bring all that information together and show you the main things that you really need to focus on and the things that you need to stick with you throughout your career. And reading these rationales and taking these practice tests shows you the things that are most important in nursing. because everything that you learned in nursing school is not going to be on this test. So I used 2 different online programs in order to study, just like I used 2 different books. I used UWorld and I also used the Kaplan online program. Kaplan was provided for me by my school, so we had a Kaplan instructor come to our class and give us a 1-week course about NCLEX, and we also had access to the online program that some of you can buy if your school doesn't give you access to it. Some major differences between UWorld and Kaplan. So Kaplan, I think, is better at teaching you how to approach the questions and how to break them down and come up with the right answer, while UWorld is helpful more for just practice, doing these practice tests and getting comfortable with taking these tests so that you can pass. So the Kaplan instructor taught us a bunch of things that are also in this online Kaplan program. So I didn't have to spend too much time on the online program because we had got it in person. So I'm going to give you some of the tips that I got from the Kaplan instructor that really helped me out during the test. So the Kaplan instructor really focused on prioritizing care for the patients, such as who do you see first when you have 5 different patients with 5 different things going on. So one way you can approach these kind of questions is to make a list of all the different critical conditions that each patient has and basically tally it up. So whoever has the most conditions going on with them, they probably need to be seen first. Another approach is when there are emergent situations, you need to think they need to be seen first. So examples of emergent situations would be a patient with a closed head injury presenting to the emergency room. They're going to need assessed because you don't know what's going on with them. It could be something serious or it could be just a concussion, but they need assessed. So that's an emergent situation, and that's somebody that you will want to see first. Another example would be a pregnant woman with placenta previa. You want to see her first because that is a situation that can result in fetal demise or worsening condition of the mother. Another thing that Kaplan taught me is whenever you get a question and the answer choices may have 2 opposites in them. For example, the answer choices may be low blood pressure, high blood pressure, Crohn's disease, or diabetes. So what are opposites? High blood pressure and low blood pressure. So according to Kaplan, whenever you see these kind of questions, the answer is usually one of the opposites. So you should focus on the opposites and narrow it down that way. I actually did not like the online program. I didn't use it as much as I used UWorld. The online Kaplan program, it has pre-made tests for you already. You start off taking a test that may have 75 questions. However, the next test you take is going to have more questions. And the next test will have more questions. And it goes all the way up to you'll be taking a 270 question test. So once I made it to the test that had about 150 questions, I basically just stopped using that program and switched to UWorld. Kaplan does break down the categories and show you your results, show you how you're doing in each category, just like UWorld does. However, when you're taking these tests, Kaplan does not show you your results. It doesn't tell you whether you got the answer right or wrong until you complete the whole entire test. So when you're taking these tests, if you do decide to use UWorld, you should be aiming for a range of 55% and 65% was about what my range was. So that's pretty decent. I know it doesn't sound good, but you really should just be aiming to be above the average or at least at the average. And as long as you're above or at the average and you're getting about 60% average on your test, you should be fine for NCLEX. This will be my world. I told you so. This will be my world. I told you so. This will be my world. I told you so. This will be my world. It is the day before the exam. What are you gonna do? I'll tell you what you're not gonna do. You're not gonna study. You are going to relax. Take a breather. Take a breath. Think about how much you have studied. For me, it was like a month and a week. My brain was like, I've had enough. I need a day off. You do not want to study up until the last minute of the exam, because that's not benefiting you. If you feel like you need to do that, then you need to reschedule your test, because that probably means you're not ready. So I would suggest the day before the exam, you participate in some self-care. Relax. Go get a massage, get a mani, get a pedi, get your hair done, go out with some friends. Because it has been a long ride of studying and you probably haven't had a lot of time to do things like that. This is the day that you want to do that. Don't do anything stressful. Do things that will keep your mind off of the test. Even if you feel like you could use some more studying, just do not do that. I did not take my own advice. The Kaplan instructor told us that you should not study the day before the test. Do not do a practice test the day before the test. You know, that is your day to relax. And that was my plan. I did go get a massage. I did do some self-care. I relaxed a bit. But I was so used to studying that I was like, let me just do one more practice test, you know, just more information. It could only help me. However, I did terrible on that practice test. I got like a 38%, which was worse than I did on any of the other practice tests. It was worse than my first one I took before I even started studying. So that shows you that your brain is it's burned out at that point, and really you have prepared enough. So you need to relax the day before the exam. Make sure you go to bed at a good time. It's very important to get up and make sure you eat a balanced breakfast. If your test isn't until the afternoon, I would suggest not eating like a big lunch, because you don't want to be sitting in your exam with an upset stomach, and you don't want to be thinking about, oh, I gotta go to the bathroom, things like that. You don't want to be worried about that. The only thing you should be worried about is that exam. So do not eat too heavy before the exam. Well guys, that is all I have for you. Let me know if you have any questions. I'd be happy to answer. Let me know your thoughts on the video. Let me know if it helps you. Comment, tell me whenever you pass, because I want to know. And good luck, although you do not need good luck, because you got this in the bag. You prepared for it and you listened to my tips. You made it through nursing school, which that really is the hard part. At this point, have a positive attitude. That is the best thing you can do for yourself. So even after the exam, when I was leaving, I wasn't sure how I did. I was like, I got the minimum questions, so I was feeling good about that. I wasn't 100% sure, but I only let those thoughts stay in my head for so long. From that point on, I told myself I passed. And when anyone asked me, how'd you do? Like, how do you think you did? Did you pass? And I'm like, oh yeah, I did good. I passed. I felt very prepared. I faked it until I made it, basically. Good luck. I wish you guys all the best. Thank you for watching my first video on YouTube. Please like it, subscribe to my channel. I'm going to be posting a lot more videos. Obviously, I'm a new nurse. My specialty is psych. So I have a job now as a full-time psych nurse, and I'm gonna be making more videos about what it's like starting off as a new graduate nurse, what it's like being a psych nurse. I'm gonna be talking about lots and lots of stuff on this channel, and if there's anything you want me to talk about, you can make a comment and I will make a video about it. Also, I plan on getting into travel nursing as soon as possible. Unfortunately, you have to have at least a year of experience to get into it, but I'm counting down the months and the days and the seconds because your girl wants to go to California, okay? And I'm actually working on getting my California license right now as well. Yeah, that's all I have. So guess who's an RN? I am. Guess who's about to be one? You are. You got it. Now, go study.